I'm Cory Goldberg. I'm a plastic surgeon and a craniofacial surgeon in Toronto, Canada. My practice is a combination of facial, breast, and body surgery. I do both cosmetic as well as reconstructive surgery. My general philosophy of my practice is that I like to give patients comprehensive care. It's very important to me to give them not just the surgery, but the care and support that they need around that to have the best possible experience and the best possible recovery. When people think about surgery, they often think about the basic components of recovery as far as taking pain medication and antibiotics. But often we forget about all the other support that we need to give patients. The biggest process is the inflammation and the swelling that occurs after surgery. This is a big part of the patient's experience as far as how much swelling they have, how fast they'll recover, and how quickly the swelling will come down. A lot of pain after surgery results from inflammation, and the inflammation is a component of the oxidative stress that they're experiencing as a part of the surgical procedure. I've taken on a nutraceutical because I really believe that this is a way of minimizing that inflammatory process, reducing the swelling and inflammation after surgery, and thereby reducing recovery time by reducing the swelling and reducing the pain that the patients experience. We know that the SOD is the most powerful form of the antioxidant. Because it works in an enzymatic way, it gets reused, and in fact each one SOD molecule can neutralize up to 1 million oxygen-free radicals as compared to the other antioxidants which you'd get from berries and other components such as that, which really with each oxygen-free radical, the antioxidant is then destroyed and can't be used again. So we know that the SOD is the most effective of the antioxidants. Glisodin, as far as I'm concerned, is the leading edge of the nutraceutical industry. The component, the glisodin, the superoxide dismutase, stimulates the body's natural ability to form SOD, and that antioxidant is the most powerful antioxidant that exists. It's the primary antioxidant, and as such it's able to, in an enzymatic way, reduce the free radicals that are produced by the inflammation after surgery and other components of aging such as sun and UV exposure. But as far as surgery goes, by reducing that oxidative stress, it reduces that inflammation. So when it comes to my facial cosmetic surgery and also the breast cosmetic surgery that I do, all of my patients are given a package of the pre and post formula, and I start them for 15 days before surgery and continue them for the 15 days afterwards. I include that in my surgical package for all patients. That's not an additional fee for them, because I really believe that it's an integral part of the service that I'm offering them. For my body contouring patients, I like to get them a course of the detox before they do surgery. Ideally that's started about a month ahead of time, and they do their 2 weeks of detoxification, and then I get them onto the slimming formula, which they'll do for a couple of weeks before surgery and then continue after surgery as well. Ideally I like my patients then to continue using this slimming formula on an ongoing basis in order to optimize results and make sure that there's no rebound weight gains after the surgery. So the pre-post formula, I would say the most obvious procedures that I've noticed a difference in are my rhinoplasties and my facelifts. I'm finding that my rhinoplasty, where there was often a need for some pain medication up to a week after surgery, at this point I find that my patients usually stop taking anything by around 3 to 4 days. Similarly with facelifts, my experience was generally patients would take pain medication up to around 5 days, and at this point it's probably more about 3 days. Additionally, the amount of swelling that I've seen after these procedures is reduced in my mind. So as a basic science researcher myself, I was very impressed by the 22 clinical trials that Glisodin has performed, which shows the efficacy and the bioavailability of the SOD molecule. It's a unique technology because it allows the SOD to be available in the small intestine, where it can stimulate the natural production of the superoxide dismutase in the body. The technology allows that to be protected from the hydrochloric acid in the stomach, and that's what makes this a unique entity. I have been on the slimming formula for over a year now, and I also use intermittently the advanced detoxification formula about once every 4 months. Between the detoxification and the slimming formula in the past year, I'm down 30 pounds, and I owe that both to a healthy lifestyle and as well to the slimming formula from Glisodin. In addition to that, for my skin health, I use the advanced anti-aging formula during the fall and winter months, and in the spring I usually switch over to the advanced brightening formula because of the photoprotective component that it has.